In this video we'll briefly discuss what is morphine, how it works, what it's used for, the dose and side effects, contraindications and precautions. Morphine is a centrally acting opioid analgesic. It binds to opiate receptors in the CNS, and blocks ascending pain pathways. So it reduces patients' perception of pain, without altering cause of the pain. It also causes respiratory depression, peripheral vasodilation, inhibition of intestinal peristalsis, sphincter of Oddi spasm, stimulation of chemoreceptors that cause vomiting. It is available as both immediate and sustained-release tablets, and also available as oral solution and as injection. Morphine injection and immediate-release tablets are used in the treatment of severe pain, and the sustained-release tablets are used to treat severe and persistent pain, especially cancer pain. The usual dose of morphine for adults is 10 to 30 mg every 4 hours as needed. And when using sustained-release tablets for adults, 30 to 100 mg every 8 to 12 hours. When using it as subcutaneous or intramuscular injection, 5 to 20 mg per 70 kg every 4 hours. And when using it as intravenous injection, 2.5 to 15 mg per 70 kg, in 4 to 5 ml water for injection over 5 minutes. The usual dose of morphine for children, when using it as subcutaneous or intramuscular injection, 0.1 to 0.2 mg per kilogram every 4 hours. And the maximum dose is 15 mg. Do not administer to patients with severe respiratory impairment, or decompensated hepatic impairment. Do not initiate treatment with the sustained-release formulation in elderly patients, or those with renal or hepatic impairment. Begin the treatment with the immediate-release formulation. Administer with caution to patients with respiratory impairment, head injury, raised intracranial pressure, uncontrolled epilepsy, or ureteroprostatic disorders. Do not combine with opioid analgesics, with mixed agonist-antagonist activity. Increased risk of sedation and respiratory depression, when combined with alcohol and drugs acting on the central nervous system. Common adverse effects of morphine include dose-related sedation and respiratory depression, nausea, vomiting, constipation, urinary retention, confusion, raised intracranial pressure, and pruritus. In the event of overdose, it may cause excessive sedation, respiratory depression, and coma. And the management of respiratory depression includes assisted ventilation and/or administration of naloxone. And patients should be monitored closely for several hours. Take this medication with food if gastrointestinal upset occurs, and monitor for gastrointestinal irritation. Avoid alcohol and other CNS depressants such as sedatives when taking this drug. Avoid driving and other activities requiring mental alertness, or that are potentially dangerous until response to drug is known. Change position slowly, in particular from recumbent to upright, to minimize orthostatic hypotension. Do not increase the dose of morphine, if you are not experiencing sufficient pain relief, without approval from your treating physician. Do not stop morphine abruptly when you have been taking it for more than 2 weeks, as a withdrawal reaction may occur within 24 to 48 hours. Do not take over-the-counter drugs without the approval by your treating physician, as some of these may potentiate the CNS depressant effects of morphine. That's all for this video. Subscribe and click on the bell icon for more animated medical videos like this one.